For a patient with Achilles tendinitis that just won't heal, won't get better, would regenerative treatments like PRP or stem cells or exosomes be an option? My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, in these videos on regenerative treatments and regenerative orthopedics, I want to make it very, very clear. I am not promoting them. I'm not telling you to do them. All of my videos, I'm not giving you medical advice. It's meant for general information and educational purposes only. But especially when it comes to treatments that are labeled as experimental or used off-label, these are things I just want you to know about. You should talk to your doctor. You can talk to your doctor to find out if these are right for you, but I am not pushing them on you in any stretch of the imagination. But today I want to talk about sort of a new area in sports medicine, and that's regenerative treatments, specifically as it applies to Achilles tendinitis. Now, if you've ever dealt with Achilles tendinitis, you know it's really difficult. It's this nagging pain in the back of your heel, the back of your lower leg, and it can be really frustrating. You feel it with walking, you feel it with any kind of pushing off. What the condition is, we say it's an inflammation, but it's much closer to an Achilles tendinosis or tendinopathy, where there's a degeneration of the Achilles tendon, which, as you know, is the thick band of tissue connecting your calf muscle to the heel bone. It's involved in pushing off or jumping, running, things like that. And that's why you see Achilles tendinitis, Achilles tendinosis in athletes, in runners, even weekend warriors, especially as you get into your 40s and 50s. And it's related to overuse and tight calves. Some people think it may be improper footwear. Typically, it manifests as pain, but sometimes it's swelling. Sometimes it's stiffness in the Achilles tendon. Sometimes you can even feel a thickening of that Achilles tendon down close to where it inserts into the calcaneus. And if you leave it untreated, it can eventually lead to small tears within the tendon or even a full Achilles rupture, but more importantly, more of a chronic nagging pain that can go on for months and months. Now, early on, when it's truly a mild Achilles tendinitis, conservative treatments typically work well. Things like rest, ice, physical therapy. And those physical therapy exercises may involve calf strengthening and flexibility exercises, maybe anti-inflammatory medications. Some people advocate for orthotics. Some people feel strongly against orthotics, but that's typically what we do in mild cases. And in a huge percentage of people, especially early on, that does well. The problem comes when it becomes this chronic, significant issue. And sometimes it gets bad enough that even you're talking about some type of surgery to trim out a small part of the tendon that's degenerative, even potentially repair the tendon. But again, these treatments we talked about don't really address the poor healing inside that tendon, the tendinosis or tendinopathy. And that's potentially where some of these regenerative treatments come in, whether it's PRP or stem cells or exosomes. What these treatments are trying to do is trying to use your own body's healing mechanism to repair and regenerate the damaged tissue, the damaged tendon and tendon fibers. And in doing so, that would potentially be a much less invasive alternative than, say, a surgeon. And I have seen us use these a fair amount for treatments, and I've seen good outcomes, especially in the people that aren't doing better with some of the traditional treatments. The most popular option is, by far the most popular option, is platelet-rich plasma, or PRP, where we draw your blood, spin it to spin out the red and white blood cells, concentrate the platelets and its growth factors, and inject it right into the tendon in the area of tendinosis, a lot of times under ultrasound guidance, with the goal of stimulating repair of that tissue and stimulating cell growth, collagen production, and also potentially reduce inflammation. The studies show, at least that are out there, and we actually have pretty long-term follow-ups, at least for Achilles tendinosis, maybe not some other things we use PRP for, but the data has been pretty good for pain relief and functional improvement, even in chronic cases. There's studies that show up to 90% satisfaction rate years later. Generally safe, minimal side effects other than some injection site soreness. Now, where people are going past that are things like stem cell therapies and exosomes. With stem cells, typically we're talking about mesenchymal stem cells that we get either from your bone marrow or from fat tissue, adipose tissue, and they differentiate into tendon-like tissue. They also are thought to release anti-inflammatory signals. Now, The early clinical trials do show benefits, pain reduction, better mobility within about 6 months, no significant complications or other adverse effects. Not great studies in terms of randomized control studies, but at least what's out there has been very good. Exosomes, there really aren't many studies to this point for Achilles tendonitis, but you would think that that would have similar effects to stem cells as, and I've talked about this in other videos, many people believe the exosome within a stem cell is what's actually doing the work of the stem cells. So in theory, that would be another regenerative option for Achilles tendinosis. The potential benefits are very clear. Now, for the vast majority of very early on tendonitis, maybe you don't need it. But for the people with chronic Achilles tendinosis or tendinopathy, that could potentially be a significant improvement compared to surgery. Quicker return to activity, more natural healing without surgeries or other foreign materials. But again, the data is early. We need longer term studies against placebos to see if it's better than some of the traditional treatments. Also, as I've talked about before, these regenerative treatments generally aren't covered by insurance, so you're paying out of pocket. Again, they're considered experimental by the FDA, at least here in this country. And so there's a lot to think about, and it's something that you really ought to talk to your doctor about. Regenerative treatments for Achilles tendinosis may be a good option for you, but talk to your foot and ankle surgeon, your orthopedic surgeon, and see if potentially it's right for you. Again, for all the reasons I outlined before that. Now, I've written an entire ebook about a variety of regenerative treatments and other treatments that aren't regenerative. It's called the Arthritis Solution, but it applies to far more than arthritis. If you want a copy, you can get it completely free. Just click the link in the description below this video. If you have an orthopedic injury and you want to hear about options other than surgery and other than cortisone shots, you can click the link in the description under this video, fill out the contact form, and learn more about scheduling an appointment to see me. I'd also love to hear your experience with your injury. Leave those in the comments below this video. Just understand, if you leave a question in the comments, I can't offer you medical advice, but I might, like I did here, answer your question in a future video. Also, make sure to subscribe to my channel, click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.